Well, I've been asked to talk today about Thermi. My name is Dr. Brian Kinney, and we're in Beverly Hills in our clinic in the Spaulding Surgery Center. It's a Spaulding Center of Plastic Surgery Excellence. And Thermi is an idea that was first conceived of by Dr. Leonard Miller and then by myself. The two of us together had worked on a number of new technologies, and we had formed a group called Technology Development Partners. And this device was used in the spine to heat tissues by putting a little probe inside the spine to heat up and shrink the tissues. And what Dr. Miller had come up with was this idea that the tissues are shrinking around the probe. So he asked me one day, wonder what would happen if we put that thing in the neck and tighten it. Well, we got our chance in 2010 and 11 to look at this. And so what we did was we did a few patients and we found that there was some tightening. Now, we know that tissues will tighten, and 85 Celsius is about 175 Fahrenheit. That's where we were treating the nerves, to disable the nerves, to get rid of pain, and also to disable the muscles, to give a botulinum toxin-like effect. So smooth out all these muscles if you want. So we were very successful that early. And then we realized you could tighten the neck, and that would be at about 60 degrees, or somewhere in the range of 150 to 160 Fahrenheit, 60 Celsius. Then we realized you could stimulate collagen at about 47 degrees Celsius, in the range somewhere between 110 or 15 and 125, and we were able to do that. Now, in the summer of 2012 in Dallas, Texas, Paul Hirschman and Kevin O'Brien hosted a little meeting, and Dr. Miller and I attended. And that's where Thermi was founded. So this big thing called Thermi, with all this great success, was conceived of in the summer of 2012. Starting in January of 2013, we had built up a good group of doctors. In the beginning, September, October, November, December, we were meeting in very small groups, 3, 4, 5 doctors. And by January, we had about 15 or 18 doctors interested in using the machine. At the end of 1 year, we had done about 120 procedures with about 20 machines. Pretty slow start. Then we went on to the next year, the summer of 2014. We'd done a couple thousand treatments with about 100 doctors, and then 300 or 400 machines. And now 2016, by summertime, after 4 years, we'd had almost 100,000 treatments and 1,100 doctors. In small groups, starting in September of 2012, in our clinic in Beverly Hills here, this is where we started. We actually started here at this desk, sitting around this desk, comparing notes, giving lectures. And what we did was 3 or 4 at a time, we'd have discussions, we'd share our knowledge, and then we'd go and do a case. And we just tighten a little bit here around the neck, a little bit in the jowls. So we've grown to 100,000 treatments, 45 countries, 1,100 doctors, and now we do Thermi Tight, we do Thermi Raise, which is smoothing of the muscles and the face. We do Thermi Breast, we do Thermi Va for vaginal tightening after childbirth and for urinary incontinence. We do Thermi on the knees, we do Thermi Dry, and so it's grown into a full world of Thermi. Elsewhere on YouTube, you'll find a video I did that was presented at the Cannes Plastic Surgery Film Festival in September of 2015. It won a silver medal, and that walks through exactly how it's done, step by step by step. But here, I just wanted to talk to you about the history and the development of Thermi. So with 1,100 doctors doing Thermi, probably I've taught 500 or 600 of them personally myself, and then the other trainers also have been trained by people who trained with me. We've done trainings in Bangkok, we've done them in Jakarta, we've done them in Manila, Tokyo, all through the U.S., 20, 30, 40 cities in the U.S., London, Hamburg, Paris, Bologna, Barcelona, Istanbul, all over the world. It's been a tremendous growth, and a lot of new people have had access to this. We are still rapidly expanding and plan on doing more and more in more countries as Thermi continues to grow. Our results have been very, very good. If you look just at the neck, Thermi tight, I could say that probably 65 or 70% of the patients say, oh, this is fantastic, I love it. Another 15 or 20% of the patients will say, that was pretty good and I can see a difference. And about 10% of the patients will say they see a little bit of a difference. And there's always, like any procedure, a few, maybe 5, 7% that say, well, I didn't really see much. But the good part is that it only takes downtime of a day or two, or sometimes even just that afternoon, people will return to work the next day. Then you get kind of a half a facelift without a facelift is what we kind of call it, with minimal swelling. And it's really gone very well. Now, some of the newer things we're working on emphasizing is the combination of InstaLift with Thermi, and the concept is called a Thermi Lift, Thermi Tight InstaLift. And so I'll be talking to you more about that later. And in addition, once a month for the last 5 years, I've been doing a thing called Ask Dr. Kinney. And we've been doing it with doctors. And so I've done perhaps 100 hours of these, maybe even more, of training doctors. We'll present cases and we'll look at them, we'll do teaching. And what we may be doing in the future is seminars to the public where it will be Ask Dr. Kinney with the public about Thermi, and that should be very, very exciting. So there's just a quick introduction to the world of Thermi, and in other videos we'll go through and give you specific things about patients and specific things about specific procedures. For now, bye-bye. We'll talk to you again soon.